Introduction. Welcome, medical students, to today's lecture on salivary gland tumors. This comprehensive script will delve into the intricate details surrounding the classification, epidemiology, anatomy, embryology, molecular pathogenesis, clinical presentation, evaluation, diagnostic challenges, staging, prognostic factors, surgical management, radiation therapy, novel therapeutic approaches, tumor recurrence, specific characteristics of adenoid cystic carcinoma, and management considerations of uncommon salivary gland tumors. The aim of this lecture is to equip you with a deep understanding of salivary gland tumors, their diagnosis, management, and challenges that may arise throughout the process. Salivary gland tumors are a diverse group of neoplasms arising from major and minor salivary glands, classified based on histology, location, behavior, and genetics. The WHO classification system is commonly used. Incidence is low, 3 to 6% of head and neck neoplasms, with a peak in females aged 50 to 60. In order to understand salivary gland tumors, it is important to know about the anatomy and embryology of salivary glands. Salivary glands produce saliva and include major glands like parotid, submandibular, and sublingual, as well as minor glands in the oral and nasal cavities. During embryonic development, salivary glands form from the lining of the mouth. Complex interactions between tissues control their growth and formation. Any disruptions in this process can lead to specific types of salivary gland tumors with distinct characteristics and genetic changes. Salivary gland tumors result from genetic alterations that drive their initiation, progression, and behavior. Different subtypes possess distinct molecular profiles, including chromosomal rearrangements, gene mutations, and abnormal signaling pathways. Identifying these genetic changes is important for personalized treatment and prognosis prediction. Clinical presentation of salivary gland tumors can include painless swelling, facial asymmetry, difficulty swallowing, hoarseness of voice, and facial nerve paralysis. Diagnosis involves patient history, physical examination, imaging, and tissue sampling for cytology and histopathology. Expertise is needed to accurately diagnose and classify tumors. The preoperative evaluation of salivary gland tumors using fine needle aspiration cytology, FNAC, provides rapid results and is cost-effective. However, it has limitations in accurately distinguishing tumor subtypes, grading, and histological differentiation. Histopathology of excised tumor specimens remains crucial for definitive diagnosis and treatment planning, requiring close collaboration between cytopathologists, surgeons, and the integration of clinical, radiological, and histopathological findings. Staging of salivary gland tumors is crucial for determining disease extent, prognosis, and appropriate treatment selection. The most widely employed staging system for salivary gland tumors is the American Joint Committee on Cancer, AJCC, TNM, tumor, node, metastasis, classification system. This system considers tumor size, local invasion, lymph node involvement, and distant metastasis. Alongside staging, identification of prognostic factors assists in delineating disease behavior and patient outcomes. Prognostic factors include tumor grade, histological subtype, presence of perineural invasion, presence of lymphovascular invasion, and molecular alterations. Integrating these factors into clinical decision-making allows personalized management strategies for patients with salivary gland tumors. Surgical management plays a central role in the treatment of salivary gland tumors, aiming for complete tumor resection with minimal functional and aesthetic morbidity. The choice of surgical technique and approach depends on various factors, including tumor size, site, histological subtype, and preoperative evaluation. The surgical options include superficial or total parotidectomy, submandibular gland excision, and neck dissection for regional lymph node involvement. Endoscopic-assisted techniques and minimally invasive approaches have gained popularity in selected cases, minimizing scar formation and optimizing cosmetic outcomes. In advanced cases or high-risk tumors, multidisciplinary treatment involving surgery, radiation therapy, and targeted therapies may be indicated. Salivary gland tumors can be treated with radiation therapy, which can eliminate remaining cancer cells after surgery or be used as the primary treatment. Techniques like external beam radiation therapy, intensity modulated radiation therapy, and proton therapy offer precise tumor targeting with minimal side effects. However, radiation therapy may cause salivary gland dysfunction, dry mouth, mucous membrane irritation, skin problems, scarring, and an increased risk of developing another cancer. Effective communication and long-term monitoring are important for managing these side effects. Advancements in understanding salivary gland tumors have led to new treatments. Targeted therapies inhibit molecular changes and dysregulated pathways. Tyrosine kinase inhibitors like cetuximab and sorafenib show promise, and immunotherapy with pembrolizumab and nivolumab is being explored for aggressive or refractory cases. This offers personalized and potentially more effective treatment options. Local, regional, and distant recurrence of salivary gland tumors presents challenges in management. Salvage surgery, re-irradiation, systemic therapy, and palliative care are key approaches. Molecular characteristics guide systemic therapy choice, while palliative care addresses symptom relief and quality of life. Adenoid cystic carcinoma, ACC, is a unique salivary gland tumor with distinct characteristics. Microscopically, ACC shows cribriform, tubular, and solid patterns, with paraneural invasion. ACC is associated with the MYB-Fib fusion gene and has a prolonged course, tendency for local invasion, distant metastasis, and late recurrences. Managing ACC is challenging due to its elusive nature, resistance to conventional therapies, and propensity for paraneural invasion and distant metastasis. Ongoing research aims to uncover molecular pathways and develop targeted therapies for improved outcomes. In the section on uncommon salivary gland tumors, we discuss the challenges in diagnosing and managing these rare tumors. Examples include mucoepidermoid carcinoma and acinic cell carcinoma. Accurate diagnosis requires thorough examination and consideration of clinical, radiological, and molecular findings. Treatment varies based on tumor characteristics. Salivary gland tumors are complex and diverse, requiring a comprehensive approach. This lecture aimed to provide students with a thorough understanding of classification, management, and characteristics, enabling confident patient care in the future.